Welcome back to another health-focused episode on your favorite channel. I'm Dr. Francis, and today we're diving into a topic that affects over 250 million people worldwide, hepatitis B. And I'm Pharm Lawrence. In today's episode, we're unpacking everything, from what hepatitis B actually is, how it spreads, symptoms, prevention, treatment, and even busting some dangerous myths. This episode is a complete masterclass. 1. What is hepatitis B? Hepatitis B is a viral infection caused by the hepatitis B virus, HBV, that primarily affects the liver. It causes inflammation of liver tissue and can be acute, short-term, or chronic, meaning the infection lasts more than 6 months. The liver plays a central role in detoxifying chemicals, metabolizing drugs, and producing proteins vital for blood clotting. So when HBV invades, it doesn't just make you feel sick, it can seriously compromise your health over time. 2. Types of hepatitis B. There are 2 main types of hepatitis B. 1. Acute hepatitis B, a short-term illness that occurs within the first 6 months of infection. Many people recover fully and develop lifelong immunity. 2. Chronic hepatitis B occurs when the body can't fight off the virus, and the infection lasts longer than 6 months. It can lead to serious complications like cirrhosis, liver failure, or liver cancer. Whether or not someone develops chronic infection often depends on age and infection. For instance, 90% of infants infected at birth will develop chronic hepatitis B, compared to about 5% of adults. 3. How does hepatitis B spread? HBV is found in blood and certain bodily fluids, and it can spread through mother to baby during childbirth, unprotected sex with an infected partner, sharing of needles, syringes, or other drug injection equipment, blood transfusions with unscreened blood, sharing of personal items like razors or toothbrushes with an infected person, exposure to blood via open wounds or cuts. Please, it does not spread through coughing or sneezing, hugging, handshakes, sharing utensils or food, breastfeeding unless nipples are cracked or bleeding. 4. Symptoms of hepatitis B. Most people with acute hepatitis B may have no symptoms at all, especially children. But when symptoms do appear, they may include fatigue, loss of appetite, nausea and vomiting, abdominal discomfort, especially in the upper right quadrant, dark urine, pale stools, jaundice, that is, the yellowing of skin and eyes, joint pain. And in chronic cases, symptoms may not appear for years or even decades, until liver damage is advanced. That's why it's often called a silent killer. 5. The science. Pathophysiology of HBV. Here's a quick look at what happens inside the body. HBV enters liver cells and uses them to replicate. This triggers an immune response, which leads to inflammation and damage to liver tissues. Over time, if the virus remains in the liver, it leads to fibrosis, then cirrhosis, permanent scarring. This can reduce liver function and increase the risk of hepatocellular carcinoma, a type of liver cancer. 6. Who's at risk? High-risk groups or people at verge of having HBV include babies born to infected mothers, healthcare workers, people with multiple sex partners, or STIs, people who inject drugs, individuals undergoing dialysis, people from regions where HBV is common, like sub-Saharan Africa, East Asia, and the Pacific Islands. Travelers to high-prevalence areas should also consider vaccination. 7. Diagnosis of hepatitis B. Hepatitis B is diagnosed with blood tests. These include HBsAg, hepatitis B surface antigen, shows current infection, and THBS, indicates recovery or vaccination. HBcAg, core antibody, suggests past or ongoing infection. HBV DNA test, measures the viral load. Liver function tests, to assess liver damage. Doctors may also recommend the liver ultrasound or liver biopsy in advanced cases. 8. Prevention, the power of vaccination. The hepatitis B vaccine is the most effective prevention tool we have. It's usually given in 3 doses over 6 months and offers over 95% protection. It's part of the routine immunization schedule in many countries. Infants should get their first dose within 24 hours of birth to prevent mother-to-child transmission. Additional preventive steps include use of condoms during sex, avoiding needle sharing, ensuring blood products are screened, universal precautions in healthcare settings, Post-exposure prophylaxis, take a vaccine within 48 hours of exposure. 9. Treatment of hepatitis B. For acute infections, most people recover with rest, hydration, and good nutrition. But for chronic hepatitis B, treatment focuses on slowing down the virus and preventing liver damage. In this case, your physician prescribes medications for you. However, some of the medications include tenofovir disoproxil fumarate, TDF, entecavir, pegylated interferon alpha, usually for a limited duration. Treatment is long-term, often lifelong. Patients must have regular monitoring, that means blood tests and liver scans every few months. 10. Living with hepatitis B. Living with hepatitis B requires a healthy lifestyle. Avoid alcohol, it worsens liver damage. Eat a balanced diet rich in fruits, vegetables, and lean proteins. Exercise regularly. Avoid unnecessary medications that may strain the liver. Get regular checkups. Also, tell close contacts so they can get tested and vaccinated. And remember, there is no shame in having hepatitis B. 11. Myths versus facts. Let's bust a few myths. Myth: you can catch hepatitis B from food or water. Fact: it's spread through blood and body fluids, not contaminated food or water. Myth: if you look healthy, you can't have hepatitis B. Fact: many people are asymptomatic for years. Myth: the vaccine can give you the disease. Fact: the vaccine contains no live virus, it cannot infect you. 12. Final words. Hepatitis B is a preventable and manageable disease. But only if we raise awareness, encourage testing, and promote vaccination. You're not sure of your hepatitis B status? Get tested today. If you're negative, consider getting vaccinated. If you're positive, talk to a doctor about your treatment options. Thank you for staying with us on this vital topic. Together, we can stop the spread of hepatitis B. Don't forget to like, subscribe, and share this video. Someone out there needs this information. Stay informed. Stay healthy. Stay safe.